Well, state health officials tonight say doctors, hospitals, and health departments are not inflating the number of deaths caused by COVID-19. That's despite a lot of information that's swirling on social media.
The online firestorm came after the Centers for Disease Control said about 94% of those who have died with COVID-19 also had other medical problems known as comorbidities.
Lansley Daniel found out some say that's proof the pandemic is possibly being overblown.
It's likely most people have seen claims on their social media feeds, claims that the CDC quietly changed the way it reports deaths attributed by COVID-19, admitting that most who have died also had other health issues. But from Nashville to the Tri-Cities, the facts show that COVID-19 is claiming thousands of lives.
The data is simply saying what we know. It's not saying that anything we've said has not been true.
That new data from the CDC causing confusion for some on how COVID-19 is listed on a death certificate. In a webinar back in July, the state's chief medical examiner broke this down.
If the COVID accelerated their demise, that should be coded as a COVID death.
Today, the state health department sent back a statement saying, in part, if it is listed as a contributory cause of death, the case will have the COVID-19 code indicated, but not as the underlying cause of death. And we would not report that case in our public tallies. However, it's not uncommon for multiple codes to be listed on a death certificate.
And trying to separate codes out, looking at whether it was a COVID code only or had additional codes with it, is not really the appropriate frame of reference for looking at this.
Experts in our region say it's important to understand that the virus is causing an excess in deaths.
Most of the people who have asthma or diabetes or whatever high blood pressure, they're not expected to die next week. And so we know that because they get COVID, that's what's causing the death.
A spokesperson for the Tennessee Department of Health told me tonight that the state is reviewing every death certificate listing COVID-19 as a diagnosis, with the express goal of minimizing the overreporting or underreporting of COVID-19 deaths in Tennessee. Josh, Sarah.